One of the most rewarding things that we do in our practice is evaluating patients who have a variety of complex pain disorders, whether it's joint-related pain, nerve-related pain, or even spinal disorders. And we're actually able to help them the vast majority of the time without any kind of surgical intervention whatsoever. Usually this is done by percutaneous or injection-based techniques that are safely done under image guidance with very minimal to no downtime. And we also are able to help patients and prevent them from having future surgery. In our practice, we have a very modern approach to treating pain. As interventional pain specialists, we've kind of strayed away from that older ideal of prescribing a lot of high-level narcotics and pain medications. We really have an interventional first approach to care in our practice that typically consists of a functional rehabilitation program to provide mobility and restoration of function in conjunction with a non-invasive, image-guided, safe, and targeted pain relieving procedure. For a lot of those types of patients, we have a wide variety of interventional options in our practice where we can help restore their quality of life.